I'm concerned about the stress that New Yorkers are feeling and the increase in mental health issues, the anxiety issues, domestic violence, substance abuse. And I'm concerned that the damage being done is greater than we even now know.
That Governor Cuomo posting a message on Twitter as we continue to see how the COVID pandemic is also causing an outbreak of mental health problems. In fact, the National Institute of Mental Health is warning that we will see a big spike in things like depression, substance abuse, PTSD, and even suicides, and the system may not be able to keep up. Also, the medical professionals on the front lines are perhaps feeling this most acutely. They are dealing with death and suffering, sometimes on a daily basis, and also with isolation, as many of them have quarantined themselves so they will not infect or expose themselves to family members. The death of Dr. Lorna Breen in New York City, it shed some light on the stresses that they're facing. The doctor took her own life last month, and her father said she worked in the trenches and she should too be considered a victim of COVID. So let's bring in our guest to discuss Dr. Sanam Hafeez. She's a psychologist who is on the faculty at Columbia University. Doctor, thank you for the time. And let me first start with medical professionals and also first responders, because there's been a double whammy of sort in not just what they've been exposed to, but also that they've had to basically, in many cases, self-isolate themselves from their families. And what I'm particularly concerned about is if there's a second wave, and that second wave was in part caused by fill in the blank for leadership saying you don't have to social distance, you don't have to even bother putting on a mask. So much of the suffering and so much of their hard work would have gone for naught. How concerned are you if there is, or when there is, a second wave? And if it's sooner than later, just how much of a toll that's going to take on this population?
It's a sort of a double-edged question, because PTSD is definitely on the rise, not just for EMS workers and frontline workers like doctors and nurses, but also the general public. I conducted a very large-scale study in 2002 on EMS workers and FDNY in New York City, and it was post 9/11. The study wasn't designed to be conducted after 9/11. It just happens to be, and I found that at the time the general rate of PTSD in the general public was about 8 to 9%, and in first responders in New York City back then it was about 16 to 18%. So you could just imagine that was one acute incident that happened, and it impacted the city greatly. This is an ongoing chronic event that is having an effect on multitude of factors, from everyone's physical well-being, concern about their family, financial impact, and also not knowing when this is going to end or how it's going to end and what the world's going to look like post-COVID. So I think there's just so many layers to how this mental health impact is going to play out.
I've had doctors that have been in ICUs in some of the hardest hit hospitals that have joined me on set through this. And one of the things that stuck with me is they and a lot of RNs have many times become the last lifelines for families who obviously cannot be there with their loved ones in their final hours, and they have to serve as a conduit, and they have to put a brave face on this as well. They have to have conversations about end-of-life decisions, and sometimes, especially at the height of this, almost play Solomon in terms of who gets care and who doesn't, triage medicine, and they can't have anyone to share their pain with. To me, I think that's such an underreported part of this, what they have to be carrying around with them.
Absolutely. I mean, all of us, from our day-to-day stressors, we go home to spouses, children, parents, friends, someone that we can unload on, to some degree. We can share our grief, our burdens, our stressors, and that is a very important part of how we function socially, emotionally. And all that support's sort of been ripped away from a lot of these first responders. They're either self-isolating themselves, or even if they're going back to their families, they're exhausted and shattered and really don't even know where to begin, how someone who was dying maybe told them their last words. I mean, what an immense emotional burden to carry, and that grief, and then just sort of it's the nonstop barrage of the physical and the emotional toll is a lot for anyone. Doctors and nurses and frontline EMS workers, they're trained well, but I don't know if anything could have prepared them for this ongoing turmoil.
And then we get into the broader population, doctor, and it runs such a gamut. I mean, obviously we see people who've lost their livelihoods and are now worried about, well, how do I, keep the lights on in the house, and do I make the decision between, tuition or the mortgage or whatever the case may be. And then I've got a senior in high school, and at one point I said, oh, stop. This should be your biggest problem. You're not going to have your prom or your graduation. But for an 8-year-old, that's a big deal, let alone what is a college graduate? What are they walking into? What kind of a world are they about to go into, let alone a job market? Everybody gets to have, not their right to feel sad and their right to be unsure about what happens next, don't they?
Absolutely. We spend a lot of time saying things like, well, be grateful. You've got food on the table. You've got a roof over your head. But that also sort of minimizes what people are feeling. So, congratulations to your high school senior. It's a huge rite of passage that, he's going to be missing out, and college graduates are going to be missing out on that as well. But they're also faced with a much more daunting prospect for what the job market's going to look like after this. And not being able to celebrate with your friends, being cut off from people who are your major support network. It's a lot. And yes, when you sort of take that away from them, you are minimizing their suffering, their grief to some degree. And which is why it's important to say, look, we can worry about these things because our basic needs are being met. If we've got food on the table, we've got medicine, we've got access to doctors, no one's, kicking us out of our home. It's still a lot to be grateful for, but it's hard to remember that every day as these things are unfolding. And it seems to be just ongoing. Even when states are beginning to open up, we have continuous, valid scientific warnings that there might be a second wave. There's a good chance that there'll be a second wave, and don't get too comfortable. So it seems never ending, right? And as adults, that's hard enough. But if you're that transitioning adult, it's your world is just beginning to open up, and it's a lot.
I'm sure for professionals like yourselves, there is counseling that can be done remotely, but I've heard from folks that it's not the same thing. And when you look at some of the numbers, and some of the numbers are down, whether it be for people calling in for certain, whether it be substance abuse or domestic abuse, but people say, be afraid about those numbers because there's an underreporting going on because you can't leave the house. Where do you go? Talk about the data you've seen and what it tells you and what worries you.
So what worries me is what I sort of predicted and saw it coming when this pandemic started. I said, anyone who was drinking a little bit is going to be drinking a lot. Anyone who was somewhat abusive is going to be more abusive. No one is coming out with these behaviors out of the blue. These were all behaviors that were somewhat there, but they were being buffered by the day-to-day life. They were being buffered by work, by the demands of life, by family life, by, social obligations, familial obligations. Now people are in each other's faces all the time. Your worst fears, your darkest times are sort of upon you. And I think what ends up happening is that, there was an article in the New York Times that talked about how domestic violence is actually on the rise in New York City, but the numbers that were being called into the precincts were much lower. And then when they interviewed individual people, they said, well, I thought if I call the cops, I'm inviting the virus into my home. Yes, my husband beat me, but I also don't want him to go to jail and get sick. So people are very nervous about the outcome of what might happen if they seek out help. One of the things that I talk about is that mental health professionals like myself, psychologists, psychiatrists, we can do a lot via, this sort of a medium. It's not ideal. Do I like to see patients in the office? Absolutely. But if that means that I can sort of intervene and provide some sort of, a buffer between someone who is afraid of going down a bad road with alcohol or substance abuse or domestic violence, at least it's something. Doctors like us don't have to draw blood or check for lumps. So this is definitely a positive. And I think there are a lot of people who probably always thought about or wanted to reach out for help. This would be a good time to do it. Everyone's state has some funding where there are free services available for counseling and for therapy. And I really urge people to take advantage of that.
The amount of infrastructure and staffing to deal with as the doors open, the amount of people that are going to be looking and needing help. I was even thinking of like an AA meeting, with social distancing and how that would work out. How does that work here? And then obviously all the people, as you mentioned, suffering from PTSD or even suicidal thoughts here, as we've seen some of the numbers spike even there. Do we have the infrastructure to support how many people need help that also haven't been getting counseling in the meantime?
I saw a very daunting number the other day. In 2017, worldwide, there were almost 800,000 deaths from suicide. That number floored me. I know there was a great number. I just, when you see statistics, it sort of hits you how bad something is. So suicide has been a pandemic for a long time. And this COVID-19, I think it's going to give rise to a lot of suicide ideation, suicide attempts, and the system is not equipped to help all those people, all those individuals. It just because it's not designed, even medically, we weren't designed for this, as we're finding out, as disheartening and as concerning as that is. And the mental health system is going to need a lot of support to help people with mental health disorders and suicidal attempts and ideation.
Dr. Hafeez, I really appreciate you giving us a few minutes today. Thank you.
Thank you very much. Be well.
You as well. And when we come back, everyone, we're going to shift gears. We're going to talk some politics. And while everyone rightfully and understandably focusing on the COVID outbreak, our president and the First Family have been on a rampage on Twitter and even in real life. After the break, I'll give you the ugly details.